Nursing can take a toll on you mentally, physically, and emotionally.
As nurses, we do give so much of ourselves to care for other people, and I think as a profession, we're not always good about making sure that we take care of ourselves too.
If we're not taking good care of ourselves, it's difficult for us to take care of others.
Burnout is a very real thing, so I think it's important to have great ways to decompress when you're not at work.
A long time ago, in 2005, we weren't talking much about self-care for nurses, and that started coming out, I would say, 10 years later. So I think it's really important to talk about self-care for nurses because it is difficult, and if you don't sustain yourself, you won't make it.
We teach that to our patients, we teach that to the families as well, that yes, your family member is very sick, your family needs a lot of care, but you also need to take care of yourself.
Being raised from a long line of nurses, so I saw, my family make me a priority, as I make my children a priority. We were always doing something fun when my mom wasn't at work, and that was really important in my life growing up, and that's something important now.
I do a lot of yoga because that's mentally calming for me and also helps me kind of get into my body and stretch, because we stand for long periods of time. In the cardiac cath lab we wear lead, so that's like 10.5 pounds on your body, so I really love yoga.
I ski with my kids, we go camping, I'm a runner, I love to be physical, I love the outdoors, so I just find any way that I can to disconnect.
I love to run, maybe I'll sing in the shower, maybe I'll sing at events, maybe I'll spend time with our physicians, nurses, or staff members around the PICU, and we just love to hang out.
In your back pocket, you need to have things that fill your cup and then things that feed your soul. Fill my cup is a pause, a cup of coffee, and a cookie. That can turn me around for an entire day. Something that's gonna feed my soul on a deeper level is spending time with my family. And so I need to make sure that I carve out time for that to really fill that silo up all the way so that I'm ready to go.
I've created a habit for myself as far as workout regimens, as far as my massages, as far as my facials.
Watching movies that I want to watch. It's spending time with my family, having meals together, traveling together to new places.
I like to do paint by number, which just allows me to kind of dive into that and not think about other things. And then chatting with colleagues and talking through debriefing after difficult experiences.
I've got a wife and I have 2 small daughters, and it's just really important for me to carve out time to spend with them. Walks around the block with our dog or taking time to go camping. It's just really important that I create space and don't overload myself with work.
I like going to the beach. I like listening to music and podcasts and spending a lot of time with my family because that is my happy place.
I married a really nice guy who's very supportive of me and will listen when I feel like I need to talk about something and be supportive or maybe offer a perspective that I haven't thought of. So I would say having friends or a partner in life that you can talk to when things get really difficult.
UC Davis provides help for us too when situations are tough.
There's programs like Reigniting the Spirit of Caring. It's a 3-day course that really allows nurses to take a step back away from caring for others and really look at themselves and what they need.
I believe having the support of other healthcare workers help you get through those situations that take a toll on yourself. Having friends within the same scope of practice and in the same field to vent to.
I work very closely with a lot of nurses on our floor as the chair for our unit-based practice council. And I meet with our committee chairs every month, not only to improve our practices, but also how can we support each other.
Just having people that you can truly trust and talk to about situations.
If I am happier and I take care of myself, I can come to work and take care of others.
You have to take care of yourself, but the patient does come first when you walk into the hospital. So, knowing that you need to provide sometimes is hard for new nurses, but you build up that confidence and you face the challenges day to day.